Dr. Denise Ejo, the CEO of Cornwall Cancer Foundation. I would like to welcome you to our Cornwall Cancer Foundation page. Our goal is to create an awareness of the challenges, support and guidance experienced in managing cancer care for sufferers, family, carers and friends. To engage with us, don't forget to subscribe to our channel. Click our notification bell.
Good morning. Good to be here today, actually. And how am I today? You don't want to know. But we're good. We're good. Yeah. How are you guys?
We're fine too. We're doing well. We expect a robust conversation on cancer health today.
A very different perspective.
Exactly, yes. This time focusing on the role of pharmacists in the treatment options.
Good morning.
All right, so let's yield the floor to you to do your thing.
Good morning, everyone. And today we're back on our cancer awareness campaign, trying to create cancer awareness in Nigeria. My name is Dr. Denise Ejo. And with us in the house today is Helen Ebenezer, who is a UK-trained, qualified and specialist clinical and technical pharmacist. She has substantial experience working with oncology and hematology. Please bear with me. Cancer patients in the UK and globally. She's currently working in a private hospital back in the UK and specializes with the cancer patients and children care at the moment. Helen, good morning and thank you for joining us.
Good morning, Dr. Ejo, and thanks for the invite. It's good to be here.
Thank you. Today we're going to be having a different perspective of this cancer journey, and I'm looking forward to it because we talk about everything to do with cancer, but we don't talk about all the different aspects of the journey. And for me, I think that has become very important for us to all be talking about. So, as especially coming from a non-medic perspective. So I'm going to start off with you. Are you seated and are you ready to go? Let's go. Yes. What are the treatment options available to cancer patients from your perspective as a pharmacist?
So treatment options obviously are dependent on several factors. These include what type of cancer a patient has, how advanced the cancer is. It also includes the actual patient's clinical status. So how well are they able to tolerate treatment, and obviously any possible outcomes of their treatment. Treatment can be aimed at controlling the disease for a period of time. For example, if a tumor is caught at an early stage, that can offer a better prognosis, or treatment can be aimed at curing the cancer. For example, with blood cancers, treatment is aimed at putting patients in something called remission, which can last for a number of years. Alternative to that is where a cancer has actually advanced to a particular stage. It may be stage 3 or 4, and the only option then would be or the safest option rather, would be to actually control the symptoms of the cancer, in which case something like pain. So it will be medication to control the pain and help improve the patient's quality of life and overall well-being, as opposed to aggressively treating the cancer. So there have been new advances in medicine that have introduced a lot of alternative treatments for like targeted cancer treatments and stuff to date. However, the 3 main options would be surgery, chemotherapy and radiotherapy. Those are still the standards for treatment, and most cancers would incorporate 1 or 2. Like, for instance, if it's something that they are going to treat with oral chemotherapy, they might just do that. Or take breast cancer, for instance, if it's caught at an early stage and it has not advanced to other parts of the body, as in metastasized, then they can actually locally, surgically remove the tumor from the breast, but then also give chemotherapy on top of that to help reduce the chances of the cancer coming back. So so surgery, chemotherapy, radiotherapy would be the main treatment options for patients.
You made this very simple for me this morning. Thank you. That was very nice. I actually got it. So where are we going now? What is your main role as an oncology pharmacist? Because I'm actually focusing more on that, because we in our setting, although we're talking from London today, we still have all our family and everybody we care for back in Nigeria. Yes. And this campaign is about Nigeria. So I'm looking at it from that perspective, yeah? Yes. What is your main role as an oncology pharmacist in supporting patients during treatment? And how does it differ from the role of an oncology doctor? And I'm very particular because that is something I never grew up. And for somebody who grew up, was born in Lagos and grew up all my life in Nigeria, that is the concept I've always understood, that the doctors are in charge. But since I started this journey, I have really come to realize that the left hand must know what the right hand, it's like, it's way wider than we, the public, actually understand how the care is organized.
Yeah. So basically, here in the UK, we have individual specialist pharmacies who are, hemonc pharmacists is what we call them, hematology oncology, or radiotherapy pharmacist, surgical pharmacists. There are different individual pharmacists who can specialize in those areas. But as a hemonc pharmacist in particular, obviously the oncology doctor is the first port of call for the patient, because they would do the diagnosis, they will refer the patient for tests, they will interpret the tests, they will decide what treatment the patient is supposed to have, and also, they will be the ones prescribing the treatment. So where the oncology and hematology pharmacist comes in is in a place where they are a support for the patient, as well as the doctors and the oncology team in total, because it is a team effort. Like you said, the left hand must know what the right hand is doing. So contact with the patient, the pharmacist can have that. They can, get a accurate and, up-to-date medication history, whether it's prescribed medication, whether it's supplements, whatever the patient is taking, because obviously you need to have a holistic idea of how the patient is before you start treatment. So they can get medication histories, present that to the doctor to say, okay, this and this and this is what is safe to still take, or if we need to refer the patient for a different kind of treatment. They basically ensure that treatment is safe for the patient. They ensure that care is optimized as part of a team. And also, in terms of the actual medication themselves, they help the patients manage their medications. So most cancer treatment has take-home medication. So after you've had your treatment, if you're not on an oral course of chemotherapy, for instance, when you've had the injection, the infusion, whatever, they have medication that you take home. So your pharmacist can explain why you have to take these, what they're for, what to do if something goes wrong, things like that. Side effects is also another thing that, pharmacists can help patients with, because obviously medications have side effects. And I believe that we probably will talk about that in a bit. But the doctors can do this, especially in a place in Nigeria where maybe the hemonc pharmacist is not a very, very well-recognized role, as opposed to here. A doctor can also do this, but, as I said in the beginning, support is what the pharmacist is there for. Support for the patient, the oncology doctors, and the team as a whole, because obviously you have the nurses, dietitians, a whole range of specialists.
Trust me, I know what you're talking about. I had a nightmare, so I know what you're talking about. I think I'm still trying to recover. Are there any problems? Are there any problems a patient can expect as a result of a treatment?
Yes.
And how would they manage them? So basically, I'm taking it forward from your comment about the side effects, actually.
Yeah. So we know that all medication can potentially have side effects. And because chemotherapy is actually it's a toxic type of treatment, the the aim is for it to target the cancer cells and destroy them. And when that is happening, your chemotherapy drug does not differentiate between the cancer cells and the normal divided cells of the body, because the same way that the normal cells divide, cancer cells divide as well, except more rapidly, and they try to take over the entire body. So because the chemo is targeting dividing cells in general, side effects come up from, places that you have rapidly, constantly dividing cells in the body. So the skin, the gut, the mouth. And what the doctors do is they generally would anticipate any possible side effects and try to incorporate that into your treatment plan. One of the major side effects people experience, and I'm pretty sure, Dr. Ejo, you have experienced this as well, nausea and vomiting. Now, whether a patient experiences this or not depends on what type of chemotherapy they're on, and how severe it is also depends on the actual agents they're receiving, the chemotherapy agent they're receiving. So it's always anticipated that if the chances of nausea and vomiting are higher, then something is prescribed into the regimen. Maybe it's an injection that you take before the actual infusion to stop any vomiting, whether it's something that you take home to take regularly, there's always something available, a medication available to help manage those side effects. Others are diarrhea, things like diarrhea, a sore mouth, dry skin. Again, medication is available that the doctor can prescribe to help with this. And also people obviously experience hair loss. Breast cancer treatment, for example, has something called a cooling wig, and that is used to help reduce that side effect happening. A low immune system is also something you can experience because the blood counts drop and stuff. But this is something that probably will present as a fever and needs immediate medical attention. So any patient experiencing that should immediately contact their doctor, because they obviously need something to help boost their blood counts again. Taking your medications regularly, whatever it is that you're given, obviously help with side effects, but sometimes patients find that this doesn't work and the side effects are manageable. In a case like that, it is good to contact the doctor, because what the doctor can do is the doctor can either look at changing whatever it is that you're on to something that might be more effective, because it might just be that you don't agree with that particular medication. For example, for vomiting, you're still vomiting despite there's something else you can take. Or they can look at reducing the dose of your chemotherapy treatment, because a lower dose might agree more with you, or changing it completely, in which case they would say that the treatment has been changed due to unacceptable toxicity. So yeah, these are ways that I believe, and obviously if there's a pharmacist available, you can always talk to them, find out what advice they can give you as to how to manage any side effects.
I'm actually smiling because everything you said, I went through. Everything, from the being bald, the cooling hair. Now, yeah, I just took it off because I started looking at patches and I thought, oh no, I need to look good. Doesn't matter whether we're going through this. But then in the same way, we're talking about all the other things. And yes, it is true that it is necessary for us to engage in the conversations with the doctors to make sure they know, and we're telling them, well, don't try to do it on your own. That's basically what I'm trying to say. Yeah, don't try to do when you're not well, just go and see the doctor and say, look, I'm not well. It's easier that way. Okay, so in which case, how does chemotherapy work? And can you tell us survival chances on that?
So, I know we like to say at Common Cancer Foundation that cancer is not a death sentence, and it's not. There's been a lot of research, a lot of development of treatments for most cancers nowadays that has improved, survival chances of people. More and more people are surviving cancer, and they're living very close to normal lives after diagnosis and after treatment. For instance, in the UK now, over the last 40 years, the survival rates have doubled, and they're in very, very high percentages. So it's not a death sentence, and chances of survival are there. However, I would emphasize that it actually depends on awareness. We as individuals need to be aware, because one thing with cancer is sometimes it just helps to catch it at an early stage. If you catch it at an early stage, then the chances of beating it increase. So awareness is very key. Be aware of your body. Any changes to your body that you feel is out of the ordinary, speak to a doctor. Seek medical help. Go for regular checkups, where you can. Educate yourself with forums like this, so that you know what to do, where to go, who to speak to, if the unfortunate happens. Basically, chemotherapy works by, I mentioned earlier, by attacking the cancer cells. So once a cell in the body becomes cancerous, it tends to grow very rapidly and quickly, and it divides in a bid to take over your entire body. And it also uses the body's natural cell division system. So there are stop gaps in the cell division system that are supposed to stop cells from getting to the point where they are redundant in the body. But the cancer cells can actually evade this. And so what the chemotherapy does is it tries to catch the cells in those stop gaps and stop them from growing and dividing, or slow them down, slow the rate at which they are growing, dividing, such that, the medication has time to work on them. And obviously it could be oral chemotherapy, it could be infusion, and sometimes cream. Even cream can be used as treatment. So yeah, that's basically how chemotherapy works in a nutshell. I hope I'm doing justice.
No. You're speaking it the way we want to. You see, this is not a medical conversation. This is from the perspective of a patient talking to a medic. Yeah, so that the public understand what the issues are. It's not, we're not technical. We're just more focused on. You tell the public how to keep safe, please. That's all we want.
Yeah.
Okay, so oral treatments. Now, I've noticed in the last, somewhere actually along the way, I started to notice a lot about the oral treatments that came up, even in on my own journey, which is still ongoing. Using oral treatments as an example, is it a problem if a patient misses medicines? Now, I'm going to tell you why, because I'm going to confess now. I messed up last week. I messed up my drug so badly, I'm still recovering. All because of vitamin D. And I took it wrongly. So please help us with that one. Because we can make mistakes, and you're stressed. We've got a lot going on. Just ordinary vitamin D. I'm still struggling from it. So thank you.
Yeah. So I will speak from the aspect of chemotherapy as an oral treatment, and also, like you said, the aspect of messing up for whatever reason. So side effects can sometimes be so annoying that patients want to not take their medicines just so they don't experience those side effects. When it comes to oral chemotherapy, it is very, very, very important that the medication is taken. And not only is it taken, it needs to be taken as prescribed. It's very vital because, as I have mentioned earlier, the treatment is targeting those cancer cells. And those cancer cells, what they are doing is they are ready to take over the body. They are constantly dividing. So if the treatment to slow them down or stop them is not taken, then obviously it can affect treatment outcomes adversely. So it is very vital to make sure that you take it as prescribed. You need a pharmacist, or even the doctor should be there to explain to you exactly how you take it, when to take it, whether you take it with food, without food. Everything needs to be clear to the patient when taking their medicines. And if the side effects are unmanageable, like you mentioned, then go to your doctor. Like I mentioned earlier, they can change the treatment. They can find other ways for you to manage your side effects, but it is very important to let the doctor know that you're struggling to take your treatment because of side effects. And if it's a case where, for whatever reason, there's a mess up, you're supposed to take it in the morning, you forget and you move on with your day, and you remember at the time you're supposed to take the afternoon dose, please, 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 patients should never take a double dose of oral chemotherapy. It is toxic. It needs to be taken exactly as prescribed. If you miss a dose, let the doctor know, I missed a dose, but just take it at the time you remember, take the next dose. If it's too late, take it when, some ways that you can help with this is, set an alarm, have a pill box, have a plan, a medication taking plan, however it works for you. But it's very important to take those doses. And when there's a missed dose, let the doctor know.
Thank you. You made a very strong point here, which was interesting to hear. Don't take a double dose. Interesting, because a lot of the time we think we have missed it and then try to catch up, and we're doing ourselves an injustice. That is actually very interesting, because I would, like I said, I've just done so many things wrong. I always wonder how I get through, and then I start panicking. Okay, but we're being factual. All of us are prone to finding ourselves in such a position, and then we don't know what to do. Are there any drugs? This is one that I find very interesting. Are there any drugs or foods that need to be avoided while on cancer treatment? And I will always talk about this in every year a few times, because this food discussion is very important and but comes home to every single one of us, especially when we, the cancer patients, are being told what we can and cannot do. So can you help us on this?
I'll talk about medication first of all. With regards to medication, any medication that will need to be avoided will depend on what type of treatment and whether that particular medication interacts with the cancer treatment. So obviously, this is an area where the pharmacist can help as the medication specialist. So they can look up what kind of, which is why it's good to always have a comprehensive list of any medication. It doesn't matter what it is, whether it's a supplement, whether it's a prescribed drug, always have a list that you can hand to the doctor or the pharmacist if you have access to one, to say, this is what I'm taking. How does that affect my treatment? So if you're to avoid any medication, it would be the fact that, okay, it's going to interfere with your, interact, we say, with your treatment. So you may not take that one again, or you need to switch it to something different, depending on what it is. But in terms of medication, that's generally it. And then also say you want to start, because I know that people take supplements, people take alternative medication. If you want to start anything and you're on cancer treatment, let a pharmacist or a doctor know before you do, so they can tell you that it's safe to do so. It's all about safety. It's all about maintaining a safe position as possible, because you're already putting yourself in a unsafe place, so to speak, going through cancer treatment. So everything else around you needs to be checked for safety whilst you're doing that. For food, generally, I don't know of any foods that you need to avoid, but I do know that a cancer patient needs to eat, because food is vital to how your treatment works. I mean, we all need to eat on a daily basis anyway, let alone somebody whose body is being ravaged by these toxic cells. You have to be able to maintain a healthy diet. You can say, if you're going through side effects, a person can avoid maybe spicy foods, greasy foods, anything that will aggravate that situation. But as much as possible, we need to eat. Again, if there is anything that would need avoidance, probably most likely if a person is on oral chemotherapy, if there's any food to avoid, again, you will be told that, because it is the job of your prescribing doctor or your pharmacist to make sure that, you know, all the information that you need to take your treatment safely is given to you. So if there's any particular food that you need to avoid, that will be communicated to you. And obviously, again, it will be dependent on what medication you're taking. But food generally, I would say it does play an important role in helping the body fight cancer. So as much as possible, maintain a healthy diet. And obviously, if it gets to a point where you realize that, you know, you're unable to eat, again, you need to speak to the doctor and say, look, I'm finding it difficult to keep food down. I'm finding it difficult to eat because I've got all these sores in my mouth. What do I do? Sometimes there could be a dietitian that they can refer you to, and the dietitian can help draw up a food plan. So
I think that's one thing I always tell everybody that I've always met because of this food. People don't realize that the mouth gets sore, and generally you don't have an appetite and you don't like certain things, and that certain things just go off, and certain things coming that you've never eaten before. And one of the things I did find was, one thing I tell anybody that is going through cancer patient, there are some specific mouthwash things that were specific to cancer. It's not just over-the-counter ones.
That's right, yeah.
That helps you to keep the sores down, and you don't have. Oh no, I don't know anybody that doesn't keep it now, because I always tell them, go and buy that thing and keep it. It just saves you a lot of stress. What is your advice with regards to alternative medications and methods in the treatment of cancer? I am not pushing it out as a big thing, but I am, as you understand, the context in which we're talking, we have got to get people to understand the medical. I'm more focused on what medical facts talk about, but culturally, we also have to look at the terrain in which we're talking.
Yes. So the treatment itself, from a scientist's point of view, I can say that the evidence that I have to back up cancer treatment is scientific. It's your medical treatment. Alternative methods, yes, they can help. Alternative medication can help. But I would say that they help more in helping with managing the symptoms and maybe the side effects. So there might be a natural medication that a patient takes that they find helps them with their nausea and vomiting. Yes, you know, again, just seek advice. You know, we have cases, we have information available that can give us an accurate idea of what you can and cannot take. But yes, in terms of managing symptoms or side effects, alternative medication can be helpful. A positive mindset, I would say, goes a long way if you're going through cancer treatment. You want to do everything and anything you can to keep that. It's encouraged, it's good, you know. Have a positive outlook on what the end goal will be. As we said, not a death sentence, but, you know, a positive mindset does go a long way. And that, you know, would be alternative methods. However, it is that you can find, you know, a way to keep your mind positively reinforced, then please, you're encouraged to engage yourself in that.
Okay, now, as I want to round up, I'm going to make a statement, and I want you to just comment on it. With an understanding of the complexities that the medicines we take when we're taking, you know, you said the chemo, the radio, and the surgery are normally the three types of treatments that go with it. Fundamentally, chemo is the one that damages the system, the organ, the cells. Is it cells? I'm not. I keep saying that. Yeah, cells, right?
Yeah.
Okay. So that is the one that we all keep an eye on, because surgery is surgery. So a doctor, a consultant, whatever deals with that, specialist, right?
Yes.
Then you've got the radio people for those who will go on to do radio.
Yes.
But predominantly, majority of us will have some form of chemo. after either side of these two options, right? Now, when I look at it from that perspective, the question or statement I'm going to, no, I don't know, I'll just say it. The way I'm going to put it is, so for a patient to navigate an understanding that these three components can happen, one can happen, 1 + 2, 1, so 2 can happen, or all 3 can happen, or all can always happen at all times. Is that a correct reflection of the experience of a cancer patient on the drug, on the pharmaceutical, and on oncology and hematology? But I just don't like. I'm a maths teacher, please, for goodness sake. I'm not a scientist. I don't even know it. I'm a maths teacher. Like that. So yes, from that perspective, you know what I'm trying to ask. Please, can you help me? We want to round up now. I'm trying to close this now.
Yes, I would say that, yeah, it is expected. I mentioned in the beginning that those three can be, it depends, whatever treatment a patient gets depends on what type of cancer they have. Somebody who has a blood cancer, for instance, now will not need surgery. They would most probably go through chemotherapy, something called a bone marrow transplant, depending on their age. So there are different combinations. Somebody who has lung cancer might have a combination of radiotherapy and surgery and chemo. So what a person gets depends completely on the type of cancer they have. A person who has breast cancer will probably most likely have surgery. It depends on how small, how big the tumor is, how early it's caught. That can determine whether they have chemotherapy. And also other factors, because they're genetic factors, there are hormonal factors, there are so many other factors involved as well, which obviously I didn't go into because they're quite, so that also determines whether they get a combination of treatment or not. So yes, anyone who has to go through can expect to have one, more, or two, or all three.
Thank you, Helen. We really appreciate this time you spent with us this morning, educating us on cancer. Again, we really hope you really have a lovely day, and we say thank you on behalf of AIT, who is our sponsors on this program of the Common Cancer Foundation Cancer Awareness Campaign. We'd like to say a very big thank you for coming on air today to be with us and to share with us and share your experiences with us. And we want to say a very big thank you to AIT, who funds this program for us to create a cancer awareness that makes a difference to the Nigerian populace over a long time. We are all together in this. Cancer is not a death sentence, and we are working to get everybody at least knowledge. Knowledge is power. Once you know what you're doing, you know where to seek help, you find out how to do things, and you can make your own decisions. I wish everybody have a lovely day, and we'll see you soon.
Thank you.
You can follow us on Common Cancer Foundation on any of our platforms. You will find us.
A good conversation you have had. Thank you to specialist oncologist, hematologist, and pharmacist Helen Ebenezer. Thank you both for a wonderful segment you brought us today. All the best to you both.